Now please welcome to the stage Alison Barkoff, Health Law and Policy Associate Professor at George Washington University and former Acting Assistant Secretary and Administrator of the Administration for Community Living at the Department of Health and Human Services.
Good morning, Allison. Thank you so much for joining us. It's great to be here with you. Let's just jump right in. Obviously, the recent reorganizations and mass layoffs at the Department of Health and Human Services included the administration you used to run. That's the Administration for Community Living, also known as ACL. Tell us about ACL's mission and what the impact of its, axing has had on aging Americans across the board.
So for people who aren't familiar with the Administration for Community Living, it's the agency within the U.S. Department of Health and Human Services focused on older adults and people with disabilities and bringing together all of the programs that help people live in their own homes and participate in their own communities. It has a wide range of programs. You may not have heard of ACL, but you certainly know our programs. Things like Meals on Wheels, things like Adult Protective Services, Long-Term Care Ombudsman, and programs that help people transition to their own homes when they have a hospital or nursing home stay. Incredibly critical with a huge reach to 10 million older adults, people with disabilities, and caregivers. And it has had strong bipartisan support as an agency and our programs across the board, which is why I think people were incredibly shocked when HHS announced its reorganization, and in that said that the Administration for Community Living would be eliminated and its quote-unquote critical programs spread across 3 separate agencies. ACL is really about a system of supports, and so the idea that these would be separated, I think, are incredibly problematic. We've seen over half of the staff completely eliminated, the entire budget teams and grant teams, policy teams, staff in the regions, which has had a direct impact on access to services. And then in the president's budget, the leaked OMB passback, shockingly, almost 20 programs are proposed to be eliminated. All of the programs that address abuse and neglect of people with disabilities and older adults, many of the programs that focus on chronic health conditions, despite that being a priority for the administration, and some really critical programs that support family caregivers like respite. We have actually seen impacts happening already. Because of the reductions in staff, they were not able to get out funding in a timely way that was passed by Congress. And these are very small agencies that provide services in every local community and state. And we started seeing agencies having to put people on waiting lists, turn people away, things like Meals on Wheels. Protection and advocacy agencies having to stop taking in clients, stop monitoring institutions for abuse and neglect. And I think the uncertainty about both where ACL programs are going, which programs will continue, has meant really out in the networks, a lot of resources going towards emergency contingency planning instead of providing the critical services that people rely on day in and day out, literally to stay in their own homes.
You know, you mentioned the funding cuts, the staffing cuts, obviously services like Meals on Wheels being cut. I'm curious, have you heard directly from Americans who have been impacted by these cuts, say someone who was a recipient of Meals on Wheels? I imagine it's not good, but what are they thinking about this? I mean, how are they moving forward right now?
Yeah, I really want to commend the aging and disability organizations. This is a place where advocacy has been incredibly effective. I think for many of you, people with CDC, with NIH, with really big things happening at HHS, many of us were concerned that ACL and the cuts and elimination of the agency would just fly under the radar. But aging advocates and disability advocates have been incredible in lifting up the importance of these programs. I have seen so many local stories on the news where people talk about literally what these programs mean in their lives. I had the privilege of being on CNN. And, again, people might not know ACL, but people know these programs in their community. They know senior centers. They know Meals on Wheels. They know the legal agency that they can go to and get help. The state health insurance program is another one. We have millions of people who are low income on Medicare and on Medicaid, and these are programs that, help people navigate. I think the irony of the proposed cuts is that cuts to ACL mean costs to other programs. These programs that ACL provide help keep people in the community instead of in more expensive nursing homes. For one day in a hospital or 10 days in a nursing home, you can feed someone on Meals on Wheels for an entire year. And that means reduced admissions to the emergency room, to hospital, to nursing homes, reducing chronic health conditions. Literally, ACL's programs save billions of dollars every single year. So it's incredibly confusing when we're kind of looking to focus on chronic health, when we have an exploding aging population, 11,000 people literally every day turning 60 and becoming eligible for Older Americans Act programs. This is the exact wrong time to be thinking about cutting ACL and cutting programs.
So you penned an op-ed calling on Secretary Robert F. Kennedy to reconsider these cuts. First of all, have you gotten any response from the administration? Second of all, what kind of ways are you seeing recipients of these programs, former staff members, pushing back or, trying to raise alarm about the cuts?
Yes. So I wrote an op-ed together with the founders of the Administration for Community Living. Again, the idea that HHS put out is this is about efficiency. ACL was created 13 years ago for the very purpose of efficiency, taking programs that were serving similar populations with similar goals, bringing it into a single agency to make sure at the federal, state, and local levels there was coordination of programs. And really, over those 13 years, it allowed us to stretch resources further to really serve as the glue and the coordination with other major federal programs like Medicaid, Medicare, Social Security. And we really wanted to emphasize, maybe Secretary Kennedy and the administration didn't know the history and didn't know the real need. We have had no response to that op-ed, and I think what's even more concerning has been the absolute lack of transparency and engagement of stakeholders. We only know the number of people who were RIF'd literally because people are reaching out to staff and collecting, it's this person, it's that person, it's that unit. There has been no information. We are now almost 2 months past the announcement. We have absolutely no idea what programs are going to what agencies, what programs will be continued. And I think most importantly, we have no idea how, with less than half the staff, programs can be implemented, funding can go out, and in fact, the agency that many of the programs will go to, the Administration for Children and Families itself, had a nearly 40% cut in their staff. How they'll be able to take on thousands of new grants and dozens of new programs is incredibly concerning. This is where I think advocacy has been incredibly important, from the networks, telling stories in the media, and the oversight from the Hill. We heard from Congresswoman Chu about, the many letters, the hearings. In fact, later today, I will be testifying. The Democratic members of Congress felt like it was important for the public to hear from former leaders of HHS agencies that are being eliminated about what is really happening and what that means for the American people. So this is a time where there is a lot of uncertainty and a lot of chaos, and we are seeing that translate literally into the field and into the programs that people rely on every day.
You mentioned that these cuts were announced just 2 months ago. You left your post in September, penned a very optimistic goodbye letter. I know you've said ACL has been your life's mission. In September, when you were leaving, could you have imagined that we would be where we are right now today with the program?
It's pretty astounding. I have been in and out of government several times, and I certainly understand different administrations have different priorities. As you heard from each of the speakers, older adults and aging issues have always been bipartisan. I left at a time where we had literally worked in a bipartisan, bicameral way with Congress on reauthorization of the Older Americans Act. I think we all felt confident looking at the demographics, looking at the cost effectiveness of these programs, that we were on a really good trajectory. At ACL, we worked really hard, and a priority for me was, let's really think about durability. We put out the first Older Americans Act regulations in 30 years, really trying to set up the networks for success for this growing aging population. I could not, in my worst nightmares, have ever thought about ACL being completely eliminated, cost-effective programs that have had long-time bipartisan support, SHIP programs, falls prevention, adult protective services, long-term care ombudsman being proposed to be completely eliminated. And then just, to foot stomp what you heard from many of the other speakers, to look at the entire safety net system. It is not just ACL and its programs that are at risk, but literally programs like Medicaid and SNAP. And even though they don't say it's about cutting Medicare, the cuts to Medicaid are cuts to Medicare. 1.3 million dual eligibles, according to the Congressional Budget Office, will lose Medicaid. And as we heard, the most at risk from these cuts, despite people saying we are protecting vulnerable populations, don't worry, we're carving out older adults and people with disabilities, states, when they have huge budget holes, will have absolutely no choice but to cut optional home and community-based services. And in fact, I just published an article going back and looking at what happened in the Great Recession, and 50 states in DC, out of 50 states in DC, cut home and community-based services, and their waiting list grew. So this is just, I think, an existential moment for older adults, and the incredible work that we collectively have done over the last several decades to create systems that allow people to age in place with dignity and independence.
It's incredibly ironic because, as I was saying with Congresswoman Chu, both parties rely, I don't mean to make this political, but senior citizens are very, very reliable voters. You take a walk around the House of Representatives or the Senate, there's a lot of senior citizens. This president, the last president, senior citizens. So it's just remarkable to see this. My final question, I want to end on a hopeful note, and I know that, it's not a great time in this field, but is there any ray of hope here? Is there anything that you can look forward to? Maybe is there a silver lining to all of this?
Yeah, I will give a couple silver linings. One, I think that this has really created an opportunity for us to create visibility and elevate the incredibly important programs that support older adults. I want to, again, just lift up the advocacy by the aging networks, by the disability networks, and I think that in the long run will really, really help us. The second thing that I am optimistic for, we have to make it through this fight that we are experiencing right now. But I think the fact that we are really talking about long-term services and supports in some ways has created this opportunity. It's not going to happen in Congress now, but the politically impossible will become the politically inevitable. And I think it is really giving us this opportunity to think about long-term services and supports, caregiving. How do we make sure we are not completely reliant on Medicaid, a poverty program, as the sole source to support people really in their own homes and communities? So I think there is some optimism. We have to make it through, and I'm incredibly proud of just the way the community has activated, really lifting up the importance of older adults and people with disabilities and the programs across the federal government.
Alison Barkoff, thank you
Thank
so
you
much.
so
Good
much
to
for
see
having
you.
me.